and the floor is all yours. Thank you so much.
Thank you so much, Sarah. I'm going to share my screen. Please tell me if it's clear from your side. Okay.
I can see it clearly.
Thank you. So, thank you very much. Actually, it's an honor to be in this very important session. And I would like to express my sincere gratitude to colleagues in SAMA and organizers for this very important event. As a person from the Federal Ministry of Health, I really understand the importance of every single contribution to the overall challenges in Sudan and alleviate the suffering of Sudanese. So this is very important. We need to take the full advantage of every single contribution to the overall efforts. So I'm going to present a summary of two articles we published on cholera and conflict to give insights and to make use of the lessons from these articles. So this will be the contents of the presentation. We have the background, objectives, the methods we used, and the results, the recommendations, and the links of the articles, so you can have detailed look on the full text articles, and a message to medical care providers. So while I was preparing this presentation, I was thinking why this presentation for such a session, and actually the answer that came to my mind I just listed here. So this presentation about the cholera and conflict is very important to keep you informed and to have insights on the situation, so you have understanding of your role to have better performance and clinical outcomes, and also it will help in effective or make your contribution effective in controlling the outbreaks. Another thing is to protect yourselves. So this is for the medical care providers in the different levels and different positions. So they have to know what is going on and what is the situation to protect themselves and to stay safe while practicing during this complex situation. So, and also to inspire research. The gap is huge, and there are a lot of things that need to be researched to inform policies and interventions. So let's jump to the background. So cholera is a public health risk that is strongly linked to conflict settings. As you know, conflict provides suitable environment for emergence and the spread of infection. We're going to discuss the contributing factors that lead to emergence of cholera and that facilitated and exacerbated the spread in the coming slides. So it's a major public health concern in Sudan with a history of recurrent outbreaks, widespread cholera outbreaks with high case fatality ratios. When cholera occurs in Sudan, it causes high morbidity and mortality, and we have recurrent outbreaks even before the conflicts. And after the conflict, the situation is even more worse. So between August and 2023 and March 2025, until the time I'm speaking to you now. Sudan experienced two massive cholera outbreaks affecting 12 states and 84 localities amidst this armed conflict. And actually, these are the states where reports came to the Federal Ministry of Health. There are other states that with lost communication channels and reporting, and we don't know what exactly the situation there, so they are not part of this state. But maybe there is cholera outbreak or cholera circulating there, but we don't know because of the conflict, insecurities, and the lack of connectivity. So research, we conducted two studies discussing cholera in conflict. We were aiming to describe the magnitude and pattern of cholera outbreak in Sudan and its the armed conflict. This is very important to keep everyone informed, not the community and not the healthcare providers, even the health authorities and the international and national actors, and also to provide timely insights on the epidemiological situation in Sudan to direct national and international actors to mobilize more resources for outbreak preparedness and response. As you know, the gap is very huge and the resources are very scarce and limited. So any single effort to mobilize more resources nationally and from the international to have better preparedness and response to cholera outbreaks and other outbreaks. So the methodology, mixed method approach, qualitative and quantitative. For the quantitative part, we use the record cholera cases records at the national level, and for the qualitative part, we also interviewed the key informants who are involved in the preparedness and response. And we do the calculation, the epidemiological calculation, as you know, with even the statistical analysis and the testing of differences using the APInfo 7 software. And we also use the ArcGIS for to create the maps for the geographical distribution of cases. So summary of the results. You can find more details in the full text articles I'm going to share with you. And slides. So Sudan experienced, as I said, two outbreaks amidst conflict caused by the causative agent was Vibrio cholerae of O1 serotype, both in Aba and Ogawa. I think in the previous session, you have been introduced to the types and serotypes and serogroups of the cholera and their link to causing epidemics and outbreaks. So this is the causative serotype, it's O1, and the serogroups were Inaba and Ogawa. So the first outbreak that extended from August 2023 to April 2024, we had 9,581 cases reported across 10 states with 18 localities. So the attack rate was 3.5, and nearly 70% of cases had severe dehydration. So severe dehydration is really a problem, and the hydration, as Dr. Keilani mentioned, is the cornerstone of the case management of cholera. And we need to handle the issue of hydrating patients very carefully. And we also had 238 deaths with a case fatality of 2.4, which is, to me, is very high. The WHO recommends that the case fatality rate in the optimal setting should not exceed 1%. So we have 2.4%. It's considerably and significantly very high. And interestingly, more than half more than half of the deaths occurred at the health facility level. So it's not at the community level, it is at the health facility level. Yes, a reasonable number of them presented very late, that made the effort to save their lives very difficult, but some of them at the health facility for a sufficient time so their lives could be saved. So this highlights case management and the cholera treatment at the health facility level. And also we should not forget to strengthen the case management at the community level. The world is now talking about the home-based management and the community-based management that is done by healthcare workers at the community. And this decreases the mortality very significantly. So the states that were highly affected by cholera were Gadaref, Jazeera, White Nile, and even Khartoum. But the reports from Khartoum were interrupted, and the situation is not accurate. But Khartoum was affected very significantly by the first outbreak of cholera. So the outbreak duration varied from 4 to 18 weeks, but the overall period of the first outbreak was 24 weeks until it ends in April 2024. And it peaked in late December 2023, with reported cases reached over 1,400 cases in 1 week. So the second outbreak, actually, this is not part of our article, but I mentioned this from the Ministry of Health reports to keep you updated of the second outbreak, which is still ongoing until the time I'm speaking in July 2024, and it is still ongoing. And actually, it is more aggressive with very high, and even the morbidity and mortality rates are even six times higher than the first outbreak. 57,135 cases and 1,506 deaths, with a case fatality rate even higher than the first outbreak, with 2. So this is the updates of the second outbreak, and you might also hear the White Nile in the last few weeks, with cases surge in Kosti locality. And we are going to talk about this and what contributed to this surge after the cases in this year. So this is continuation of the results and how the conflict exacerbates cholera. It's very clear that the conflict affected the health system and led to collapse of the health system, and MOH reports talk about non-functional. So this limited the access to health care by a greater proportion of the community. And we have also this displacement crisis in the world, with 12 million displaced and 8.8 million of them internally displaced, living in unsanitary, suboptimal conditions, with overcrowded shelters and poor sanitation and poor drinking water. So these are all factors contributed to the spread of cholera, with limited access to clean water for IDPs and for host communities. For example, the source of infection in the first outbreak was the Atbara River. Atbara is a seasonal river, and this was the source of infection for the first outbreak. And if we talk about the surge in Kosti in White Nile, the conflict directly affected the drinking water source as the RSF attacked the main drinking water station in Kosti, and this pushed the communities to seek alternative sources of water, and that alternative sources are definitely unsafe. Some of them are unsafe wells, tankers, and direct river water. And what led to the resurgence of cholera, causing high number of cases and death. So the conflict also affected the supply chain, affecting medical responses, contributed to the limited resources that delayed the application of control measures. So the rapid response teams, these are teams that cholera detected cases, and that applies the control measures timely. So the conflict affected the timeliness of deployment of these teams, and construction of cholera treatment centers and treating of healthcare providers and so on. And we also use the cholera vaccine, but as Dr. Keilani mentioned, it is now the strategy now is single dose vaccine. It's not the two doses as it used to be. So and it was used and helped in containing the outbreak, but however, it's only 1 out of 6 pillars. So it's only one year, and we need to do the other 5 pillars, including the case management and the water and sanitation and community engagement. It might help, but alone is not sufficient. So these are the recommendations we came up with from our studies. So we highlighted the need to invest more in the local communities so they become the first responders to the outbreaks through strengthening the engagement, raising awareness, adopting community-based preparedness and response strategies. Also ensuring the readiness of the primary healthcare level through training of healthcare workers and maintenance of the flow of supplies. So whenever a case detected is able to respond in a better way, at least in the initial phase of the outbreak, and then follow the other support from the other levels. And also adopting outbreak preparedness mechanism. We have this very clear recommendation. We need to have very clear financing mechanism and budget allocation for preparedness and response to outbreaks in all the localities in Sudan. And this is actually a strategic direction that we are going to work on. And the last recommendation is research. Actually, we need to do more researches, and more researches. And especially that is done at the lower level, at the frontline level, at the health facility or at the community. These are very important to inform the policy changes and the strategic direction in responding and preventing outbreaks in the future. You can find the links of our article in this slide, and you can go and have more detailed look, as I mentioned, on the articles, reading the full text. You are all invited to read the articles. So, and this is the last thing I want to mention. This is a message to medical care providers. Their role, of course, their role is going far beyond only treating the patients. You are not just healers, you are leaders and educators and advocates in the fight against cholera. Your role is very important in early detection of cases and reporting of these cases to the local authorities so they can respond timely. And you also your role is also key in supporting vaccination campaigns and in applying and supervising the infection prevention and control measures and ensuring community engagement. You are leaders in your place, in your areas. You need to ensure the community engagement and to lead the health education campaigns. And you also lead the initiatives in your area to prevent and control cholera, and never forget to research and to conduct researches and to enrich the literature on in Sudan at your level. It will be very important and very informing for the policies and strategic direction of the Ministry of Health. We come to the end of my presentation. Thank you so much. Uh, I'm open to your questions and comments. Thank you. Over to you, sir.
Thanks so much, Dr. Ahmed, for the informative and really great presentation. And it is true that we are all responsible for, we are all responsible. Everyone can act on what we can do, but it is serious. Cholera is serious, and this is life. So every intervention really counts and might save life. So we thank you so much for this presentation, and can accept any questions. Over to Ahmed. No questions at the chat. Anyone have a question? So uh, we welcome also Dr. Martin. He is microbiologist and epidemiologist and works at the MSF. Thanks for joining us, Dr. Martin.
And yeah, thank you, Dr. Ahmed and Dr. Kiliani, for the great presentation and informative and fruitful information. Um, yeah, and I don't think I have a lot to add, and yeah, I think they are covered all. But indeed, I want to emphasize on some few points. And as we need more researches because like this research, yeah, it can really make it easier for the patient. So indeed, if we have evidence-based information that we can rely on, so this it can make it easier for the intervention for future. So research and from the this current cholera intervention and previous one, uh, of course, we learn it like there is some sessions learn it from this break, and this will help a lot. So yeah, if there is researches, this can help save more lives because as Dr. Ahmed mentioned, uh, between the cholera of 2023 and cholera of 2024, there are even more
Yeah.
the outbreak is even bigger, and the case more hair. So yeah, and as Ahmed mentioned, also medical professional and medical doctors working at different health facilities, they can participate and discuss among them and share the finding and the challenges that they face. So this can help in intervention. Also, one of the important things for me, like uh, it's really important to again to engage with community because uh, because the case management also indeed it's not only at the CTC or CTU level. It's also as mentioned, it's good to be there is an ORBs, oral rehydration centers or programs, and it's good also because the outbreak is normally big and higher than even for or for other organizations to respond. So it's really the participation of community themselves is important, and I think they participated. But we need to encourage this more and and let them themselves participate and protect themselves against cholera. And then one of the important things also, Ahmad, Dr. Ahmad also used to like in MOH used to update us about the situation. So this kind of information also it really helps to reflect and make more visualization about the situation of cholera. Um, um, so one of the things as he mentioned, and we see in the field that patient normally they came at late stage. So it's good to let them get rehydrated before and even after they came to the hospital. It's like to come early when they have an infection, and this we need more awareness. And when they come to hospital, also one of the important things for me, it's really difficult to control, but I mean because the rush of the patient and yeah, we do believe that many patients normally they will be at the floor because they bigger than what is in the real CTC or in the hospital. The number of patients normally more than the number of bed and more than capacity of staff. So to get adapt to this situation, we really need to look for a strategy and organize ourselves. For me, organizing is really important because sometimes number of patients is big, and then sometimes even the medical professionals they will get lost how to manage and when to divide the task and how to divide the task, and sometimes even patient might get lost and died within the health facility before even get assessed or or even after get assessed, then the doctor might be busy with other patients, then this one can get lost and patient with complication and children they might get lost because of this. So it's really important like to have proper triage, even the simple one. I know that is difficult to have a proper standard one, but proper triaging and proper categorization of patient, for example plan A B C, this really can help save more lives and help in the clinical case management. I know the time is almost gone, but just to mention that uh, regarding the complication related to cholera, is really also important and one of the forgotten things during the treatment of patient. Because also again because of the overload in MSF there is a and it's freely available online. I can share, and it contain also protocol about treatment and because I have seen question about some as complication with cholera. So this is also clearly written in this protocol, and indeed it's really important also to sit all together if there is no protocol about this, to have something national uh, go uh, and match with our local situation. So yeah, we can all available, and then we can make something as national protocol to help treating a patient and save lives, decrease morbidity and mortality. Yeah, thank you. This is all from my side.